Lakeland Currents, your public affairs program for north central Minnesota. Closed captioning is made possible by Bemidji Regional Airport, serving the region with daily flights to Minneapolis-St. Paul International Airport. More information available at bemidjiairport.org.
Hello again, everybody. I'm Gildow. Welcome to Lakeland Currents, where tonight we're going to talk about an organization that services central Minnesota, I think Region 5, called Sourcewell. And we've had Sourcewell on this program before, but it's such a complex and important, significant organization, we thought we should bring it back again. My first guest, and we're going to have some other guests besides Paul, but my first guest is Paul Drange, who's a Regional Solutions Officer for Sourcewell. And then when he's done giving a kind of an overview of what this organization does, we'll get into some of the specifics with some of the other people. Welcome aboard, Paul.
Yeah, thanks for having me, Ray. I appreciate being here.
And tell us, what is Sourcewell?
Sure. Sourcewell is a regional service cooperative. It's one of 9 regional service cooperatives in the state of Minnesota. We were formed by state statute, actually, in the 1970s, with the idea that one central organization could do good for multiple organizations versus what they could do for themselves. Kind of a shared service model, sort of looking at how we could affect schools, education, resources for public agencies in a better way, in a centralized way. So at that time, the state legislature took action to form these 9 geographic areas that would become service cooperatives. So our service cooperative that Sourcewell is, and the area we serve, is 5 counties right here in the middle of the Lakeland viewing area: Cass, Crow Wing, Morrison, Todd, and Wadena counties. And the statute was adjusted in the 1980s to include local units of government. And that's what we'll talk about more later with some of my colleagues that you'll meet with. So that includes serving those 5 county governments, cities, and nonprofits, as well as the school districts within the region that the original legislation tasked us with serving. So we've been around for, it's going to be pushing 50 years now soon.
Wow, I didn't realize it's been that long.
It's gone by, like, time goes by quick in a lot of ways. But we have almost 50 years, and we're located in Staples in Todd County, but we serve that whole 5-county area that I mentioned. And we have basically 3 parts of our organization. We've got, and another important distinction for your viewers is that we are a unit of government, but we cannot levy taxes against anyone in the 5-county area, and we cannot borrow money. So our services that we provide that are listed in our statute have to be able to create the revenue that we need to keep the lights on, to pay our staff, to provide services to the region. So we've got that established in our organization. We've got 3 parts to it. One is our enterprise solutions, which I can talk about a little bit, that creates revenue for us through a variety of ways. We've got a central services team, our Empowering Smart Work team, that supports that. Think about legal, finance, HR sort of services. And then our team, the team that I'm privileged to help run, is our regional solutions team. And you'll meet some of those members here shortly. And they work a lot with shared service models and supporting the cities, counties, townships, and also school districts in our region as well.
How many employees does Sourcewell have? Do you have?
We've been growing a lot in the last couple of years. I'm not sure we're north of this number, but soon we will be. It's in the range of 400 employees we have now. And when I joined 11 years ago, we had less than 60.
Wow.
So in the last 10 plus years, we've grown to that level and looking to add more to support the work that's going on in the region and those 3 parts of the organization that I mentioned.
Wow, that's amazing. And who is your director? Who's in charge of the organization?
Our executive director is Dr. Chad Coet. He started close to 12, it'll be 12 years ago now this coming summer. Chad's, and I'm saying this partially because he's my boss and partially because, a big part of it is because it's true. He's done a great job of leading the organization, growing and seeing opportunities for us to serve, and being supportive when we're looking to add additional services and team members to help serve the region and beyond.
I know the last number of years, you have been ranked as one of the outstanding places to work.
Yeah.
I know your people are spread out all over the state. They don't all work out of Staples.
Right. We actually we do take a lot of pride in that. We monitor and make sure we've got a good culture and good working environment. The Star Tribune Top Workplace Survey, we do that annually, and we've been recognized as a medium-sized organization in that study. And yeah, we actually, with adding staff, we have a lot of people that work locally, a lot of people that live and work right here in the region. In fact, all the people that you'll meet here either live in the region or just adjacent to it, the team that's here today. But we also have people in between 25 and 30 states across the country that work for us now.
Wow.
When COVID happened, we realized that we needed to broaden our workforce in a lot of the areas, and recruiting some of that talent. Of course, we still try to stay focused on our region, but we needed broader levels of talent across the country, so we have employees in close to 30 states now.
Wow. Paul, we're going to take a little break. We're going to come back and look at some of the team members who are working with Paul and Sourcewell. All right, welcome back, folks. Now we're going to meet the people that Paul was talking about who are leaders in the team that they belong to, and we're going to start with Mike, to my right. Mike, if you would introduce yourself and your title, and we'll go around the table and figure it out from there.
Thanks, Ray. Mike Willey. I am a Regional Transition Administrator on the Community Solutions team.
Hi, Ray. My name is Justin Bursley. I am the Associate Director of Community Development at Sourcewell. I lead a team of 6 community development administrators that provide zoning administration services throughout the region.
Hi, Ray. My name is Michelle Taugis. I'm the Director of Licensing Services. So we provide services for 9 counties for family child care licensing and 9 counties for adult foster care team, and I oversee a team of 8 regional licensing specialists that serve in those 18 counties.
I'm curious, how long have you folks been with Sourcewell? Mike, how long have you been there?
I've been there about coming up on 5 years.
Okay.
So I started with Sourcewell back in 2015, so coming on 10 years. I think I'm the longest standing Sourcewell employee on our team, or maybe second. Yeah.
Wow.
Yeah, so I've been here a while.
And I started in August of 2017, so I just had my 7-year anniversary with Sourcewell on the Community Solutions team.
I am amazed at where all of the folks come from. I mean, you guys are spread out a very, very large area. You're not just in Staples, or you're not just in Wadena. You're all over. Mike, we're going to start with you. I think you were going to talk a little bit about shared service. Is it shared services you want to talk about first?
So shared services is kind of the blanket term we use at Sourcewell for basically all the things that we do and things that other members of our teams do. Shared services really start with either a request or an identified need in our region that our partners, oftentimes local government or school districts, identify and say, boy, we could sure use some help from this. And Sourcewell works with those folks to identify whether there's a regional aspect to it and whether it's something we can meet the needs of. For instance, my role, I assist counties in the region and also Aiken County, serving folks who have mental health needs, oftentimes folks who are in the state psychiatric hospitals. So I help them with transition planning and finding their next spot when they're ready to leave those hospitals.
I know years ago, I remember reading that some of the school districts didn't have Spanish teachers or teachers of foreign languages. So Sourcewell helped them get someone in those positions to help teach those things that some of the smaller school districts just can't frankly afford.
Yep.
Yeah. And?
Yeah, thanks, Ray. So our team provides zoning administration services to 27 cities throughout the 5-county area. The smallest city we work with is the city of Manhattan Beach. They have 65 residents, that's our population. The largest we work with is the city of Little Falls. Their population is about 9,100 people. And so our team, full of zoning administrators, does all aspects of zoning in these cities. So in some of the larger cities like Brainerd, Bemidji, Baxter, they have sort of a full staff of zoning experts there at City Hall. We work primarily with the smaller cities that don't have that level of expertise. And so a bulk of our work is, I'll say, land use permitting, so day-to-day permits. We're not building officials. We don't do plan reviews or building inspections, but we do issue what we call land use permits. We're looking at the use of property, so making sure that the proposal fits, say if it's a dwelling, making sure that that's an allowed use in whatever district their property is located in. We also do office hours in our city. So some cities we work up to, I'll say 10 hours per week, going up and meeting with property owners and developers and contractors to assist them through the permitting process. We also prepare staff reports for monthly meetings. Then we go to either the Planning Commission or council meetings to present those reports and offer recommendations on those requests. So really, yeah, we're able to handle all aspects of zoning administration in these smaller cities.
So Justin, are you alone in that position, or do you have people helping you that are team members?
Yep, so we have a team of 6, 7 including me. So between the 6 members, actually, I am the zoning administrator in 2 cities still. I just took on this new position. So each Sourcewell employee has 4 or 5 cities that they are responsible for. So we work as a team, but each member has their own zoning specific cities that they work with.
So if you get 7 or 8 requests, how do you determine where you start spending your time?
In terms of what
zoning,
city assignments?
Let's say zoning in a zone.
Yeah, I mean, so it's city specific. So some cities do as many as 100 permits a year. So that might be the bulk of someone's work. Another city, like the city of Manhattan Beach I mentioned, I think they may have did 2 or 3 land use permits last year. So in those smaller cities, we're only billing a couple of hours, maybe a year in some instances. And some of the bigger cities, we have more of a presence. We're doing office hours, and we're there on more of a routine basis.
How does a person get a hold of you if they need help? Let's say they're from Monaga, which is out of your zone. But
right, so we do just only serve the cities that are located within Region 5. Yep. So typically, say someone wants to build a dwelling, like Michelle said, so they would contact City Hall to obtain the permit application, the city's application form. They would submit the application form along with the site plan, the permit application fee to City Hall. The clerk would then send us that information. In some cases, we do site visits, so we go out actually on site and look where they want to build their structure, and then ultimately we would be issuing the permit on behalf of the city.
So are the costs associated with this paid for by the cities that are doing the work?
So we do bill for the zoning administration services. It's a reduced rate from what the private sector rate would be. We're roughly half of the rate from what the private sector rate is, and that's we're able to do that through the contract purchasing program, sort of subsidizing the cost of our department. But yeah, the city does, there's no retainer fees, but they do pay an hourly rate for our services. Yep.
And Michelle, what is it that you do specifically?
Yeah, so like I mentioned, I'm the Director of Licensing Services. So like Mike alluded to what a shared service is. So back in 2017, this whole proposal, innovative idea of a regional licensing model was proposed to Sourcewell and the Community Solutions team to kind of come up with a shared service with licensing. So licensing is a county delegated service. So it's regulated by Department of Human Services, also known as DHS. And they delegate the counties to carry out this licensing services for family, child care, and adult foster care licensing. So then we have counties that partner with us to carry out the licensing duties. So my team are the boots on the ground doing the licensing on behalf of the county. And so again, this whole idea of this innovative shared service model came from the social services directors back in 2017, because this is more of a greater Minnesota initiative. For the fact that counties in rural Minnesota, it's an unfunded mandate to carry out licensing duties at the county. They don't receive any revenue from the state to carry out licensing services. And so some counties had like a 0.3 FTE, some had a 0.5. So this way the counties are like, hey, let's pool together our resources and our staffing to leverage our resources together to have a full FTE housed at Sourcewell. So then they came to us and we came up with this licensing model. I was actually the first one on board back in 2017 with this whole shared service model with licensing. And so it has evolved over the years. So we partner with 9 counties for family child care licensing. So we are in all of Region 5, which is Cascarowing, Morristown, and Wadena. And then also we're kind of unique to everybody else. We are outside of Region 5 and provide licensing services for family child care as well. So we partner with Douglas, Becker, and Stevens County in Region 4. And then come January 1st, we'll be partnering with Hubbard County for family child care licensing. And then also another service that we offer is adult foster care licensing, which we started in 2018. Family child care was our first, and then adult foster care was our second license that we partner with. And so we're in 9 counties for that service as well. So we're in all of Region 5, and then we're in Region 4, Ottertail and Douglas County. And then come January 1st, we'll be partnering with Hubbard and Becker County for adult foster care licensing. So again, when I say licensing, family child care is your in-home family-based programs, but we do license programs outside of their home as well, outside of their residence. So we call those special applications. So we regulate those programs. And then also we have adult foster care programs, which could be a family adult foster care home where the residents are living in the home with that license holder. And then we have a community residential settings that we regulate as well, as where it's a shift staff model.
So you're dealing with a very broad spectrum of people and skill levels, I'm guessing.
Yes.
Do you ever get them all together somehow or another to do some training so that they're all on the same plane, so to speak?
Yes, we do. We are fortunate where we get to offer an annual conference for both adult foster care licensing providers or licensed providers and family child care license providers every year. So we have a conference at our studio. It's a virtual conference for licensed providers to join every April. And then we have our family child care conference every September for our licensed providers to join virtually through our studio.
Interesting. Healthcare, Mike, mental health. It used to be we used to have a state hospital here in Brainerd, which had a lot of patients. Where are we at with healthcare in Minnesota in general, and specifically, what do you do in that area?
Thank you. So you're right. There used to be more state psychiatric hospitals in the state. Today, as it stands, I think for like what we would normally call psychiatric hospital beds, I think there's around 220 state psychiatric hospital beds.
Really?
Which for a population of 3 million isn't a lot.
No.
Now, there are many other psychiatric hospital beds. There's private ones. There's some forensic beds at the state, but those, have some different regulations for who they serve and when they can be accessed. So for a lot of the folks that I work with, it's a pretty small number of beds. And that's part of why the counties requested assistance from Sourcewell. So my position originated back in about 2017. The counties, through our regional adult mental health initiative, came to Sourcewell and requested assistance because there was a legislative order that said that if somebody is in a hospital and the doctors have determined that they no longer need to be in the state psychiatric hospital, the counties are charged the full cost of their care every day that they remain in the hospital.
Wow.
And today that's a little bit over $2,000 a day, which is significant, especially for, well, I was going to say for some of our smaller counties, but it's not insignificant even for our larger counties. Right. That can really be a significant burden. And so the counties made a number of changes across our region, one of those being having this position, the Regional Transition Administrator, to help with communication with the Department of Human Services in those state psychiatric hospitals, to help with facilitating transfers to local providers in the community, places like group homes, assisted living facilities, regional treatment centers, where people would go after they were ready to be discharged from the hospital. So we've been able to make a pretty sizable impact in the number of people who have to stay in the hospital longer than they need to. In the first kind of 4 years that was in effect, 2016 through 2019, on average, counties in the region altogether were spending about $1 million a year on these costs. In the last 4 years, so 2020 through 2023, we've been able to decrease that to about $350,000 a year on average.
Wow.
So, all told, that's a lot of dollars, about $2.5 million in the region. And more importantly, that's a lot of days. Like every one of those dollars translates to days that people don't have to spend in the hospital when they don't need to.
I've had hospital administrators on this show,
Yeah.
and they've talked about getting patients into their emergency rooms with staff at their hospitals not trained to deal with it. And are you still, do you see that yet, or is that changing over? It's probably been a few years since we've not talked about that.
Yeah. Certainly, I think it's still a present problem.
Still a challenge?
I would say that, because it's been a problem and because our region knows it's a problem and is trying to address it, there are really creative means that have been taken to work really hard to address it. But I also know that resources are still too limited in mental health, and there's a lot of need that just is not met with the current services we have. So I think the hospitals and the partners in the region are all working to address it, and I think things have gotten a little bit better, but I'm certainly not going to say that it's addressed. There's still a heck of a lot of need that exists for folks.
I can imagine. Justin, do you ever get requests to work with people at the higher levels to see if there's a way you can streamline zoning licenses and things like that?
Somewhat. So we do sort of partner with Region 5 Development Commission. They assist cities with creating long-range plans for cities. So our focus with our team is on zoning ordinances, which is sort of derived from comp plan. So you set your overall vision with your comprehensive plan, and then you develop zoning ordinances to sort of implement that plan. And so our team focuses primarily on those, detailed permits that are coming through, making sure the uses fit with whatever zoning district the proposal is located in, and that sort of thing. So yeah, sort of at a high level, but we focus more on the detailed portion.
Michelle, I would guess you have nothing to do with discipline, or if somebody is not following their license requirements, who comes in and checks that out?
So that is us. We're the boots on the ground. Yes.
Really?
Well, being this is a county delegated service, our regional licensing specialist, that's what also known as licensors across the state, we are regulating these programs and going into these programs, but at the end of the day, all liability still falls back on the county because it is a county delegated system. So we have interlocal agreements in place in regards to that, saying that all liability still falls back on the county. So we work very closely with the county with any type of licensing actions that you just referenced, or if there's certain violations in the program, we are having to do those violations when we're out and about doing those visits. So each program.
Is that you that has to do that?
I used
or do you
to.
Have staff?
I have staff. I have regional licensing specialists that have a caseload within certain counties that carry out the licensing duties for each adult foster care and family child care licensing services.
Those, I think, are invisible jobs to the average person, don't you think? I mean, the average resident in Minnesota probably, if they don't have anything to do with foster care or some of these areas, probably have no idea what the challenges are that are going on at that level. Do you think that's true to say?
Yeah, I think a lot of people don't understand what we all do. Again, we do regulate these programs, but we're also advocates. We advocate for these licensed providers and support them with technical assistance where we can. And at Sourcewell, we're able to do that with our resources that we've been able to implement and create for our programs through this licensing service.
And how old are children involved with foster care? From what age to what age?
So we do not do child foster care. We only do adult foster care licensing. So that's 18 and older. And then we do family child care licensing. So that could be from a newborn all the way up until they turn 10. They have to, is what a licensed program regulates when they have children in those ages.
You are all 2017 you started, I think you said 2017. You've all been about in that era in 2017. There's been a phenomenal amount of change in Sourcewell since the beginning. Because I know in the early stages, I remember when those units were set up in the state, it was almost all focused on schools, if they didn't have enough help, like I said, Spanish teachers or whatever. But I'm just amazed at how you have spread your services to such a broad area. How do they get a hold of you folks? Somebody wants to work with you, how do they get a hold of you?
So they can go to our website. Our regional team, we have two different websites, one for kind of nationally focused, that's sourcewell-mn.gov. Our regional team's website is mn.sourcewell.org, and all of our services are listed there, our contact information, and sort of more information on our services.
Now, this maybe isn't a fair question to ask this team, but I know that in the past I've seen where maybe like the city of Walker got a snowplow, and Sourcewell helped them get that. How do they work through that kind of I know that's not your area, but who would they talk to, or how do they get that information? Any ideas?
Yeah. So most of the purchasing folks at the city or the county or the local government administrators know Sourcewell very much.
So there's a purchasing section.
They work closely with Sourcewell. Odds are they've worked with us in the past to make purchases like the snowplow that you're referencing, or they've worked with Sourcewell in developing the needs of the region and the needs that they see in their specific local unit of government, which is how Sourcewell determines what we're going to add in terms of contracts that are available for those folks to buy from.
All right, we're out of time. Thank you all for jumping on board with us. It's very, very interesting what you are doing. Very, very interesting. Keep it up.
Thank you.
Thank you. You've been watching Lakeland Currents. I'm Ray Gildow. So long until next time.